Is it on now? Yes, it's on now. Thank you, Mary Gracie White, for putting all this together. Thank you for everybody attending today. You know, one of the interesting things, of course, let's talk about it. It's in the room. Well, hopefully it's not in the room, but we're in the room. And one of the things we talked about was whether or not we have this. And I'll be honest with you, my board of directors, some of the board was like, maybe you shouldn't do this. Maybe it's not the right image for a healthcare association to have people in a room together. And there were other board members who said, no, absolutely, we have to have this. And in talking with the Department of Health, Mary found a notice, basically folks saying, no, you should continue to do these things. Because what's really important here for all of us, literally on the front lines, is to understand the context of what we are facing. You understand decontamination. You understand social distancing. You understand the need to sanitize. You understand all of these elements because you do it every day. The context, though, is even larger than this. You know, if we weren't in New York and hadn't gone through 9/11, we hadn't gone through the Great Recession, if we hadn't gone through Sandy, we might question our resiliency. We are an incredibly resilient group, incredibly resilient. And many of us in this room have seen all of that and understand what it takes to kind of continue getting through this. And so part of my message this morning comes from my other part of my world, where I do a lot of Homeland Security stuff. And I've talked about leadership. And so I will start with the following. Everybody in your facilities will be looking at you. They'll be looking to see if you're afraid, if you are panicked, if you feel that you're unprepared. So if you present yourselves in a way that reflects your experience, your intellect, your professionalism, and your composure, that will spread. And that's really so important as we walk into the community of care. One of the things that I have had the privilege of seeing is the evolution of public health from the standpoint of, or the beginning point of 9/11. Right after 9/11, I was appointed by really the first Homeland Security Secretary, Tom Ridge, to a national committee on Homeland Security. And so one of the things we did was we went down to the CDC in Atlanta, Georgia. Now, that's a biosafety lab level 4, which is the highest. They actually have stocks of smallpox there. And I remember having a discussion with the chief epidemiologist for the CDC. Now, this is back in 2003. And at the time, he said to me, you know, 4 long shadows have been cast upon public health from the zoonotic disease perspective. And at the time, it was things like monkeypox, remember that? Hantavirus, SARS. It was back then. These were the things that we were looking at. And what he said was, as mankind continues to push against the boundaries of nature, and we continue to interact with nature, these types of zoonotic diseases are going to emerge. And more recently, I just had a conversation with Michael Dowling, who is the head of Northwell, as you know, the largest healthcare network in New York State. And he says, this is our new normal. We are going to be experiencing this as we go forward because of the nature of our world. And from an epidemiological perspective, it is the ability to get on a plane, travel across the globe, introduce new contagions almost within the blink of an eye. It is the fact that in many parts of the world, there are still very, very rudimentary cultures and societies that don't know about hygiene, don't know about sanitary handling of food. You know, we, remember bird flu? That came, right, from the way that they would slaughter birds in a marketplace and the blood would get on people, and then it begins to mutate. So, what are we facing now? And my backdrop on this is that I've been involved in this process with Jim Sherry, who's standing in the back of the room. He and I do a lot of work for a couple of multinational companies. And so for the last 6 weeks, we've been dealing with this issue. And so this is what we're seeing. And we're informed by folks who have access to the CDC, World Health Organization, and frankly, some of the intelligence agencies. And we predicted, they predicted the spread of this. And there's an epicenter in China, and it began to spread out. And because when you look at a disease, and doctor, please correct me if I'm wrong about this, but what you do from an epidemiological perspective, you look at two elements. One is transmissibility, and the other is lethality. And so that's the comparisons you're all seeing. Those things are not necessarily constants. They can change as the virus mutates. And that's, of course, one of the true challenges of where we are right now. You'll see in the description of the disease, novel, the word novel. That indicates that though the coronavirus, and as you know, the corona refers to the crown, which is really the morphology of the virus. It has little spikes, looks like a crown. And there are many viruses that have that same morphology. But what makes this novel is that we've never seen this particular variant. And so we're not able to predict how it's going to react when it comes in contact with large populations. And the way genetics works, it's this whole Mendel's pea pod, you do variations of the genetic sequencing, and then you see what type of expressions, that's what they call it from a genetic perspective, what expressions of the mutation actually emerge. And they could affect transmissibility, they could affect lethality. There are basic questions that we're still trying to figure out with this disease. And we have experts here who are going to talk about this. But to kind of showcase a little bit what they're going to be talking about is we don't know if this is going to go away during the warm weather yet. There's kind of two schools of thoughts. Yes, it's going to have an interval. That's what they call it. Pandemic, pre-pandemic, pandemic, post-pandemic, interval, and then another pre-pandemic, pandemic, post-pandemic. We don't know what that interval is. We don't know how long it's going to be. We don't know when it's going to come. And so the two schools of thoughts are that there won't be that long an interval. It will be pretty short and continue in kind of waves. Or there will be an interval where we'll go dormant like H1N1. If you recall, it was very active in the winter and then part of the early spring. And then went dormant. We were expecting it to come back. It never did. So what everybody's doing now is they're saying that if the longer the interval, the greater chance that there will be another mutation, which leads people to say that in the fall and wintertime, this could come back in a much more virulent form. Again, these are all guesses because we haven't had the experience and we haven't seen the various manifestations or expressions of this genetic mutation of the virus. So, what to do? Well, you guys know what to do because you do it every day. But when you take a look at, again, from an epidemiological and a public health perspective, you look at your operating environments in circles, concentric circles. So where do you start? You start with, obviously, your residents and your patients. How to keep them safe. Because you assume, since they're facility-based, they're not having contact among each other with anyone who's infected. And then you introduce other elements into the environment. Staff. So where are staff coming from? There are all sorts of issues right now as to how we deal with staff. What are the things we try to make sure that we can control? Because you can't control everything. So one of the things that I'm dealing with right now is one of the things is access if you've traveled. What we're talking to the union about is if residents if staff have traveled, we need to know. They need to tell us they've been in contact. If they're not feeling well, they need not to come to work. These are the basic things, right? On staff, when they're actually on the floor, we need to really, really refocus on personal hygiene. We need to talk to our facilities operators. 10% bleach solution kills everything, from anthrax all the way down. So a part of that should be messaging. When you come into the facility, you're likely to smell bleach. Okay? Let's tell people that so they have that expectation. You know, part of this is also going to be communication. We need to get into a regular cadence of communication. What does communication do? It does more than just inform. It gives confidence that the management and the leadership of the facility and the staff have thought through these problems. So then beyond the staff, there are all issues of labor workforce. You know, the biggest thing we're fighting is fear, misinformation, the unknown of this. We have to consider things that we wouldn't have to consider before. What if some staff decide that they don't want to show up to work? How do we incentivize folks to show up to work? What if people don't come to work because they're sick and that's the result we want? How do we ensure that they'll still get paid? So I'm working with the funds on that because I know many of you know that I'm the principal management side trustee on the 1199 funds. And so we're talking through that now. And then the other thing that you have to do is now take that concentric circle and expand it out now to visitors. And in some ways, visitors are probably the easiest thing to do. Everybody knows this is out here. So it's time to communicate with family members and say to them, look, if you've traveled or if you're not feeling well, we really need you to just, Skype. Talk to people on the phone. Give us some time. That's really what we need here. We need some time. We need to be able to understand how this is affecting the population. We need to get people to calm down. Though I'll tell you right now, it's not so bad. You know, I just spoke to my daughter late last night in California, in LA. LA just declared a health emergency. She and her friends are like, yeah, you know, we've been through this thing before. It's going to be okay. So we have to make sure that people just understand we need some time there. But that communication is really important. The thing I would not urge anyone to do is kind of hunker down. No, this is the time for communication. And then the other thing is that use the resources around you. Talk to each other. What are you seeing? What kind of, have you developed a best practice for a good cleaning solution, good cleaning regimen? You know, are you talking to the resources in government? Are you talking to your association? You know, let's see if we can share information and understand that this is something that we're all facing. And the other thing is that, you know, when you talk to the folks who've been paying attention to this a lot, they'll tell you that they predict that there's going to be a declaration of a pandemic pretty quickly, like within the next 2 weeks. Now, I hope they're wrong, but when that happens, should it happen, you have to gauge that. You have to have messaging in place, be able to talk to your staff, and explain to them what that means. Basically, it changes it's a recognition of the spread of the disease and where it now occupies itself among the globe, and it gives government special powers, basically to put more resources in. It's a recognition of that. As you know, New York just did a new law, which gave sweeping powers to the governor to be able to essentially suspend laws to facilitate an effective response to an outbreak. That's really what they did. So that's, again, what the declaration of a pandemic is. It now gets the world to focus on acknowledgement, monitoring, and resource application. That's really what that does. But the declaration of a pandemic is a scary concept because, you know, we've never had that. Everyone says, whoa, what about 1917? No. There was no such thing as a World Health Organization in 1917. And they didn't really know what was happening at the time. And by the way, when you research the pandemic of 1917, what you find out was that it spread because you had all these troop ships with all of these soldiers tightly packed together. It was almost the perfect incubator for a pandemic. We don't have that now. It was also battlefield conditions without any medicines, without any resources, nothing. So the last point is this. There's a lot of hype about the development of a vaccination. My sources tell me that that's not coming anytime soon. But there is constant efforts to be able to get that out to the street as much as possible. But everybody's expecting that this is going to be a period of time. This is going to be a longer period of time than we've experienced beforehand. And so we have to gauge that. And pandemics typically come in waves. So it's not a happy, joy kind of conversation, but it's not something that we haven't seen portions of beforehand. And I think taking it in stride, keeping it in context, and keeping communication with your residents, staff, family members, and visitors is really important. And part of that communication, by the way, is signage. Signage is really important. How you message that, right in the front door. You come in. If you're not feeling well and you're sick, please refrain. If you've traveled around places, again, please let us know. We're trying to protect the residents inside the facility. And if you see something that doesn't sound right in terms of somebody like on the floor really coughing, whatever, that type of thing, notify people. Talk to people. And continue to talk to each other. So with that, those are my introductory comments. I don't know if anybody has any questions at this point in time. Anybody? All right. Yes. So supply chains is something that the Department of Health is focused on right now. They're trying to make sure that there are enough supplies around. Now, there is information on that, which again, the doctors and I know that the public health will talk about, but there is misinformation out there about masks. Masks do not protect the person from getting the virus. They protect the person from contributing to the environment with a virus. That's important. But again, you have to prioritize who you're dealing with. Who would get the gloves, who would get the masks, and because there is not an endless supply of that. But the supply chain availability is something that the state is looking at right now very closely. Anybody else? All right, so why don't we go to the experts, and they can tell us how we're going to respond today. Mary?
Just on basically for the city homes.
Here, Mary. Because we're taping this.
We are taping this. I have to bring this mic down quite a bit. Okay. So basically, because we have homes that are both in Nassau County, Suffolk, and in New York City. Many of the New York City homes know that they've been in touch with us already, that we are at the Association the point of contact to work with New York City DOH/MH for supplies. When their supplies are exhausted, now they're passing it up to New York State. So there is a stockpile, but they do want certain information, like what are your vendors supplying? Are they supplying anything? What are you asking for in numbers? So there's some specific questions that you need to answer. So, like Mike said, communicate with us, and then we will certainly work to help you with that, because there are going to be shortages. I know that part of the funds from the governor, the $40 million plus federal, is supposed to ask suppliers to increase their supply chain by 40%. So I don't know that that's going to be possible. Most of the stuff is made in China. So, we'll work together on that, and to do judicious use of the PPE. I mean, we sent out the CDC guidance. We don't necessarily need to supply the whole community with masks, okay? If a family member comes in and they're ill, that's one case that we would address separately, but to, not have your staff panicking and using up all the supplies unnecessarily. Look at what you're using, what are your PAR levels, what do you have? All right, so without further delay, then we're so pleased and thankful for Nancy Fisher from the Nassau County Department of Health to be here today, because they are quite busy, as you can imagine, with this. And Nancy had agreed to come and present here, so she'll address some of the items on the Nassau County side. So please welcome Nancy. Thank you.
So let's see, is this mic working? Is that better? That works? Yes. Wow, terrible. All right, while they queue me up, I've been here before speaking with you. I'm Nancy Fisher, Nassau County Department of Health. I work in public health emergency preparedness and response. So I've spoken to you before about other issues. Of course, recently for us, we have been working very closely with our Bureau of Disease Control because it now has tasked our staff beyond their business as usual, and we've been running a 7-day operation for quite some period of time. I will try to kind of bring what Michael already spoke about down to a more local level for us, and I'm, again, only speaking for Nassau County because we all work a little bit differently. And if you have questions I can't answer because I'm not a clinical person, Mary is kindly going to write them down and we'll get back to you afterwards. So bear with me. And I pulled this together very quickly yesterday in the midst of everything else, so ignore the typos and anything else you might see. Thank you. Or it's off, or... So I'm going to show you some slides, and Michael did cover an awful lot of it, so I'll just quickly point to information. Just about everything here does come directly from the CDC. And I'll ask you quickly, are you all, I have a resource page at the back that you can reference, but do you all know where to go every single day to the CDC and New York State Health for the latest and greatest updates? Okay. I think that's a very important thing to just to make sure you're all pretty comfortable on just clicking in the morning and seeing what's going on. Thank you. Thank you, thank you. So this is just a history of the highlight milestones as we're following this and trying to learn more about it. So on the 30th is when World Health declared an emergency. On the 31st of January, it became a public health emergency in the US. So again, Michael spoke a little bit to this, but people keep asking us questions exactly on what that coronavirus is. So in terms of the family of these viruses and how they're related, you see, to a number of animals, but Mary, do you want to click? But in fact, this is traced back, they believe, to the bat, interestingly enough. And we've heard about MERS-CoV, you've heard about SARS, so this is officially called the virus SARS-CoV-2. And we talk about the disease in terms of COVID-19. That's more of a lesson to me because I had to learn why we have multiple names as well. And so you know about the epicenter, correct, that it happened in the Wuhan and the other provinces. You working? And I'm pointing towards, look at that, it's like magic, okay. All right, so here's where we're sort of at and about today. So we do have the cases that are happening now in the US. We know about our person-to-person contact. We're talking about community spread now in multiple locations. You're gonna ask, so I'll tell you that we've had 7 PUI, persons under investigation in Nassau County. 6 have been negative, 1 is currently pending. And so you all know this. We're learning all about it because it is novel. There's some things we do know, there's some things we believe we know, and we're not sure exactly what's going to change. So they talk about the severity of it, and we know that it can be severe. We also believe that there are likely people walking around